So we have a very nice patient coming in today, and she was concerned about her leg veins. She has multiple different types. She has more the superficial purple ones, other types the deeper bluish, and the lot deeper bluish ones. And sometimes they're referred to as varicose veins, but varicose veins are really the ones that are much more tortuous than these are, and they are larger than these, and they protrude out of the skin. Harder to treat with the injections, but these are much easier. And we typically use what is called a hypertonic saline, means a high concentration of saline that goes into these veins, and just simply enter them. And we give an injection, and you can see that these veins start blanching. And that means that we're inside the vein and causing the inner lining of the vein to go away. Over time, the body eats up the veins themselves. See very nice blanching. You see how there's a wide communication between a lot of these veins, and the whole area gets blanched. And when we do these treatments, generally I tell patients about 25 to 50% of veins get permanently resolved. Now they could always get more veins later on, but the veins that we treat, 25 to 50% of them are gone. Generally I get more benefit than that, but I don't want them to have too high of an expectation. I always try to supersede their expectations. When we do treat these, and let's say 25 or 50% of them are gone, and they come back, we do treat them again after 4 to 8 weeks, and they get any of the residual veins that are not gone. Sometimes smaller veins, the lumen is too small, and we need to resort to have laser treatments. So typically we see these veins occurring for both men and women. More often for women, pregnancy could make them worse. Genetics are the most common factor for leg veins. So if your mom or dad have these, or depending on the degree or severity that they have them, you're more likely to get them. And it's better to have them treated earlier on, because you could prevent other veins from developing once you get some of the core veins treated.
At what age did you start noticing your veins?
In my 30s.
30s?
Yeah, after having 2 children.
2 kids, okay.
Right, so having kids makes someone who is susceptible to getting leg veins, susceptibility being in the family, get the leg veins, because when you're carrying the baby, it pushes on a vessel that carries back the blood to the heart called the inferior vena cava, and that causes these veins to become more engorged and thickened, and also the hormones cause these veins to become more, or change the hormone to become more engorged. Again, nothing, you don't need to wrap it or anything, just take it a little easy for a few days after. Nothing to, no real aftercare needed. Your thoughts should be in looking for new shorts and skirts that will complement your new legs.